fair.
But
That's
wanted
fair.
to make it like touches from somebody's home and that are meaningful to who I am, so that you get a feeling for who I am before you even arrive and
Yeah.
before you even meet me in here for your checkup.
Yeah, and so in all honesty, I mean, so this whole thing is about facing fear. And when I first came here, I was terrified because I was going through hell with my dentists and my teeth, and this is one of those places that a lot of people don't want to be. It's not. Don't take it personally.
20%.
Like you're lovely.
Yep.
But people with anxiety and panic too, it's just amplified because everything about it feels out of control. And so I walked through that front door and thank God, like it was this moment of, okay, you know, this place doesn't seem horrible. It's not clinical. I'm not scared yet. I'm not scared out of the room. And so I came in, and one of the things that I am adamant about, and this is one of the things that will make it key for you to succeed in facing situations that scare you, is having open conversation. A lot of people walk into this setting and they're embarrassed to admit it. Like, I'm a grown woman and I'm walking into a dentist office, looking at the dentist and being like, I'm scared to be here.
Yeah.
And at the time, I couldn't even come alone. I had to have somebody come with me, and you know, it was one of the things I had in place to make sure that I was comfortable being here. Somebody physically had to have a hand on me so that I could somehow communicate with them if I wasn't okay, because I hadn't always advocated for myself, and I wasn't necessarily comfortable being like, okay, hold up. Because in a lot of instances, I've been met with situations where the dentist is like, come on, like I gotta get through this. I got my next patient waiting. There's stuff to do here.
Yeah.
And you feel that burden, and you are ashamed of it and you're embarrassed. But when you work with somebody and when you can be honest and obvious about it, the situation changes completely. And the likelihood of it taking that extra time that it would have taken for me to be like, hold up, I'm full of having a panic attack, we don't get to that point because we put things in place to make this very manageable for people like me who are struggling. And I gotta be honest, and I'm gonna ask for your help here for 1 second, because one of the things that got me right away when I walked in here, I mentioned that I had anxiety, and you left the room and you went and you got something, and the second you did this, I was like, oh my gosh, this is where I am going to be, because this woman understands in a way that nobody ever has. So she walks out of the room and she comes back with this. And I was like, she understands. For those of you who don't know, this is a weighted blanket. And
dusty one.
It is a dusty one because it wasn't very COVID friendly. We couldn't share blankets during
We've
COVID.
had it put away. Yep.
Exactly. But the fact that you had something physically in your office that right away, to me, I was able to know that not only did you acknowledge that this was real, but you saw something important about making the experience better for me. And I was blown away. Like, why was this here? Like, how did you, it wasn't me. This isn't here because of me. I love that it's here.
It was here before you.
Yeah, it was here before me.
So from where I came from, I had, studied psychology before I did dentistry, which is an amazing foundation to have. And even in dentistry, we do study some psychology. One of the things that I had used in an anxiety clinic that I'd worked with before is a weighted blanket. And it has been shown to be able to reduce those centers in your body with reducing the anxiety, reducing blood pressure, because a lot of people's blood pressure will rise when they're anxious. We use it for children with autism. We use it for dental anxiety. People use it who have difficulty falling asleep, so the restlessness, the restless leg, all of those types of things. And really tapping into, like we've spoken before about vagal nerve, being able to tap into that and its role in anxiety, and be able to control that and dampen down those sensations that you're experiencing. It's a no-brainer to me. Yeah,
which again, like, reason number 5,000 that I will never leave this dentist's office. Like, it's I think one of the conversations I had right away was like, you're never allowed to retire, because I'm older than you, I think. I hope. I pray. I hope. She's gotta outlive me here, because I'm never going to another dentist again. So, one of the things that I always suggest and always work on is find those tangible things that make a difference, because we see these issues and these fears as these huge problems where we have to take it all on. And it's this overwhelming, chaotic experience that we can't then break down into manageable tasks. And there are so many ways to work with your dentist within the office to break it down and make it a relatively painless experience. I mean, when I came here, the version of me you saw was somebody who was very much affected by my anxiety and not managing it well. We would have to stop the appointment several times just to let me catch my breath, do some deep breathing. And, you know, first off, even knowing that that was an option took a lot of that panic away. It took a lot of the fear away because I knew that I was never going to be made to feel like less for having to be like, okay, you gotta hold up a sec, I need to regroup here. And so now we've got this. Like I'm a pro here. I don't actually even
have a system.
I don't even mind going to the dentist anymore because it's like a safe space for me, and it's a safe space. And when you create those safe spaces out of the places you fear most, it's so empowering. Like it's such an incredible thing in life to be like, okay, this is something that used to consume my whole week leading up to it. And now it's like, oh crap, I'm gonna be late for the dentist and I forgot I had to be there. And it's not what I've been focusing on nonstop the whole time. And so, you know what, today I wanna share with you some more of those tangible tricks and some of those cool things. One more thing I wanna have a quick conversation about before we get started is around freezing. So now this I'm sure is gonna break down into a couple of different videos for me because this isn't dealing with the actual fear of needles, and if we need to go there, we'll go there. You guys let me know. But in terms of the experience for me, one, I don't like to be medicated. So any of the, and I honestly don't even know if you offer them here, but any of the assisted kind of agents in terms of gases or sleeping or you know, those are things you can explore with dentists to make sure that that is available to you. For me personally, that gives me more anxiety than to face it otherwise. So that's off the table for me, but a conversation worth having because there are a lot of tools in dentistry that you guys can offer. For me, one of the things I've always struggled with the most and that I expressed to you was freezing. It's not the needle. The needle doesn't bother me, gratefully. What bothers me is the feeling of my mouth being frozen. I don't like the sensation because to me, and as I explained it to you, especially when you're doing the freezing on the bottom and that freezing kind of trickles into your throat a bit, I really struggle with that numbness because it's kind of similar to the feeling of when I was having a panic attack, how it starts, that just feeling like I'm losing kind of control about, you know, swallowing, breathing, feeling like my throat's closing. And, you know, you actually had a response to that, which blew me away. And I just want you to explain that. You know, why is that? Why does it have that effect on me? Or what could be added to that?
So two different things. One, we spoke about in the past, the freezing gel. And I know, first of all, the freezing gel, dentists use it, you know, to make the area less uncomfortable for the actual pinprick part of the needle. You had mentioned, you know, that's not relevant to you. To other people, maybe it is relevant. To you, eliminating freezing gel eliminated a lot of the issue. And also the placement of the freezing.
That stuff just like leaks all around your mouth and you're numb everywhere.
The lack of control in that situation where, you know, is this supposed to be happening? Is this safe to swallow? Is this harmful for me? That brings on like a lot of thoughts. All of the thoughts. And you can't control it. And even though we know it'll only freeze those areas for 5 or 10 minutes, that's enough for a panic attack.
Oh, that's like enough for my panic attack to have a panic attack.
Even talking about it was probably enough.
I'm like squeezing my blanket.
And then we talked about the vagus nerve, and the vagus nerve starting, you know, at the back of the throat, connecting our mind to the physical. And you know, the vagus nerve is something that people tap into with meditation. It has the ability, if you can actually, it's kind of the opposite. If you're activating the vagus nerve and you're tapping into meditation, you're tapping into control, you're tapping into the ability to unlock your anxiety and have that sense of control. If we're starting to freeze in areas that you're losing that ability, then all of those things are going to unravel for you.
And so, and I think the thing that I loved the most was, well, one, that you had the information, because to me, always learn. Keep